Let's begin with the first section of our topic, which is chronic meningitis. And in this first section, we will talk about the signs and symptoms, clinical pathophysiology, and also systemic manifestations of chronic meningitis. But which is chronic meningitis related to intracranial meningitis and spinal meningitis will be specially discussed in our first section. So the chronic meningitis, first thing we should know was chronic meningitis. We talked in detail acute meningitis, different causes of acute meningitis, the basic difference between acute and chronic. Acute is short-term, chronic is if it's long-term, persists for a long period of time. And usually most common is if the acute condition is not treated properly and it persists, it can become chronic infection. Meningitis is inflammation of the meninges, and then what are meninges? Meninges are the covering that surrounds the brain and the spinal cord. They are protective covering of the brain and spinal cord. Cerebrospinal fluid flows between these meninges. There are three meninges. We have pia mater, arachnoid mater, and then outside is the dura mater. So all these are meninges. Inflammation of these meninges can cause meningitis, so it's chronic, so it's there for the long period of time. So chronic meningitis is the produce profound neurologic disability, and it may be fatal. We already talked about the neurological abnormalities, neurologic deficit associated with meningitis. And if it's chronic meningitis, that neurologic deficit is really very bad, poor, because it's present for a long period of time and it can be fatal. Diagnosed when a characteristic neurologic syndrome exists for more than 4 weeks. So after 4 weeks of illness, now we can label this condition as chronic condition or chronic meningitis. Associated with persistent inflammatory response in the cerebrospinal fluid. So cerebrospinal fluid is the fluid that flows around the brain and the spinal cord, and there is persistent inflammatory process. We know that now that as a result of infection or there is inflammatory response to fight that infection, there are inflammatory cells present, and that is associated, there is persistent inflammatory response in the cerebrospinal fluid. White blood cell count is more than 5 per microliter. So white blood cell count is increased because of inflammation, because of infection. If it persists, if it's for more than 4 weeks, it's labeled as chronic meningitis, and the number of white blood cell is more than 5 per microliter. And if you see in this diagram, it's inflammation of thin meninges of the brain and spinal cord, vein inflammation, and abnormal accumulation of cerebrospinal fluid. So that's the finding that are present in chronic meningitis. Remember, meningitis is inflammation of the meninges, which are covering around the brain and the spinal cord. The 5 categories of chronic meningitis, we can see the meningeal infections. So meninges are inflamed or infected. Malignancy can also lead to chronic meningitis. Autoimmune inflammatory disorders, chemical meningitis, and then we have parameningeal infections. So these are 5 categories of chronic meningitis. It can be due to infections of the meninges, it can be due to chemical compounds, or due to some malignancies that can cause meningitis, and autoimmune disorder, SLEs and lupus, and these are all some autoimmune disorders that can cause. Then we have AIDS and HIV, and these are all different autoimmune inflammatory disorders. Then parameningeal infections, any infection that is, para means around the meninges, surrounding the meninges, any infection in that area can also spread to meninges and can cause chronic meningitis. So these are the 5 different categories, or we can see 5 different causative factors of chronic meningitis. Now, the signs and symptoms associated with the chronic meningitis, we will see pretty much more or less the same as we saw in acute meningitis, but there is more serious neurological deficit associated with the chronic meningitis. So signs and symptoms, there is chronic headache. Headache is always present. So chronic headache, there is papilledema. Plus minus papilledema may be present. There is swelling of the pupil, papilledema. You can see by the ophthalmoscopic examination of the eyes. Then there is neck and back stiffness is very common with meningitis. There is stiffness of the neck, and that's very Brudzinski or Kernig sign is characteristic of meningitis. When the neck is flexed, there is automatic flexion of the hip and the knee. So that's positive in case of meningeal irritation. Then change in personality, like altered mental status, drowsiness, inattention, disorientation, memory loss, frontal release sign, grasp, suck, snout, preservation. So all these are different personality changes that are associated with chronic meningitis. Facial weakness. Facial weakness, cranial nerve, 7th cranial nerve, which is the facial nerve, is affected, and there is weakness of the facial muscle, and that is also present. Double vision. Vision due to involvement of cranial nerve 3, 4, and 6. Then we have diminished vision, papilledema, optic atrophy, hearing loss, 8th cranial nerve paresis, arm or leg weakness, myelopathy or radiculopathy. Whenever there is involvement of the spinal nerves, we will talk later on, can cause arm or leg weakness as a result of radiculopathy. Numbness in the arms or legs is myelopathy or radiculopathy. Then we have urinary retention or urinary incontinence. Again, these problems are associated with spinal nerve involvement, and it can cause urinary incontinence or retention. Then there is clumsiness, ataxia, abnormal gait. Person is not a very stable gait. They are clumsy, fall here and there. So that is also present. So these are very, very common signs and symptoms present in patients with chronic meningitis. Now the clinical pathophysiology. We have widespread dissemination of inflammatory process along cerebrospinal fluid pathways. So how this chronic meningitis develop? It's as a result of spread of inflammatory process. As a result of infection in the cerebrospinal fluid, we can develop chronic meningitis. Underlying any systemic illness sometimes can cause chronic meningitis. A specific agent or class of agents is associated with infection. CSF flow, rapid spread of infectious and infiltrative process. So as the cerebrospinal fluid flows, once the infection reaches the cerebrospinal fluid, flow of the cerebrospinal fluid can cause a rapid transmission of the infection and spread of the infection. Here, that's the lateral view of the brain and the ventricles and intraventricular foramen, and that's the anterior view. Here you can see this is the central canal, fourth ventricle, cerebral aqueduct, third ventricle. Then we have interventricular foramen between the ventricles, third and these are the lateral ventricle and third ventricle. And this is the interventricular foramen and lateral ventricle. So all these ventricles and cerebral aqueduct, these are the areas where cerebrospinal fluid flows. Now let's move on to the chronic meningitis, specially associated with the intracranial meningitis or the meningitis that is in the brain. And then later on we will talk about the spinal meningitis. So intracranial, remember it's intracranial chronic meningitis, not the acute. So it's because of the nociceptive nerve fibers of meninges stimulated by the inflammatory process. We already mentioned that the rapid spread of inflammatory process or persistence of the inflammatory process is in chronic meningitis. That's the main factor that leads to chronic meningitis. So there is nociceptive nerve fibers of meninges is stimulated by inflammatory process, resulting in the headache, neck pain, or back pain because of the involvement of the nerve fibers. Obstruction of cerebrospinal fluid pathway at foramina or arachnoid villi also cause hydrocephalus and symptoms of raised intracranial pressure. So, two main features in the intracranial meningitis, one which is associated with the increased tension or stiffness of the neck and back and headache, is the stimulation of the nerve fibers by the inflammatory process. And in the other case, if there is obstruction to the cerebrospinal fluid flow, then there is hydrocephalus, means there is enlargement of the brain as a result of increased cerebrospinal fluid. That's hydrocephalus. Hydro is for water, cephal is for the brain, so hydrocephalus. And this can cause increased symptoms of increased intracranial pressure. Here again, this is the cranium or the skull. These are the meninges of the brain and spinal cord. We have the dura mater just close to the cranium, skull, dura mater. Then we have a subarachnoid space, and then pia mater. So pia mater, arachnoid mater, dura mater. We have subarachnoid space below the arachnoid, and then we have subdural space below the dura mater. Now, some symptoms of increased intracranial pressure that occurs as a result of obstruction to cerebrospinal fluid flow. There is increased in intracranial pressure, and this increase in intracranial pressure, how it presents or what are the symptoms? Headache. Headache is always present whether it's acute meningitis or chronic meningitis, and the reason for this is the increased intracranial pressure that cause headaches. Vomiting is also present apathy or drowsiness, gait instability is present, papilledema, visual loss, papilledema is there present, then we have visual loss. All these are because of increased intracranial pressure. Impaired up gaze, upward movement of the eye is impaired, and there is palsy of the sixth cranial nerve is also present. There are 12 cranial nerves. When there is an infection or involvement of the brain or intracranial infections, usually can cause involvement of the cranial nerves, which are 12 cranial nerves. And depending on which nerve is affected, then different symptoms are present in that patient. Signs and symptoms it may. Then we have also the cognitive and behavioral changes in the intracranial meningitis are present as a result of vascular damage. Damage to the blood vessels can cause cognitive and behavioral changes. Then there might be changes or effects like seizures, stroke, or myelopathy. Basal meningitis. Basal means at the low level base. If the base is involved, if there is basal intracranial meningitis, inflammatory deposits prominent around the brainstem and cranial nerves. So in the basal meningitis, when there is inflammatory processes are prominent in the brainstem and the cranial nerves, that's the basal meningitis. Now, what are the presenting features of basal meningitis if there is prominent inflammatory processes in the brainstem and cranial nerves? Naturally, we will have features associated with different cranial nerves involvement. So there is multiple cranial neuropathies, decreased vision because of involvement of cranial nerve 2, which is the optic nerve. Optic nerve is the nerve that is responsible for the vision, so there is decreased vision. Facial weakness due to involvement of facial nerve, decreased hearing due to 8th cranial nerve, diplopia, double vision due to 3rd, 4th, and 6th cranial nerve, abnormality of oropharynx due to 9th, 10th, and 12th cranial nerve, decreased olfaction. Cranial nerve 1 is olfactory nerve, so olfaction is also affected, sense of smell is affected. Decreased facial sensation and masseter weakness. So all these are the features associated with basal meningitis, which mainly due to involvement of cranial nerves and the brain stem. So these are mostly the features you will see are due to involvement of different cranial nerves, 1, 2, then we have 7, 6, 9, 10, different cranial nerves are affected and produce different clinical presentations. Next is spinal meningitis. If the spinal meninges covering the spinal cord are affected, that's the spinal cord and that's the meninges surrounding the spinal cord. If they get inflamed, then what are the presenting features? Injury to motor and sensory roots. The nerves comes out from both sides of the spinal cord and they supply to different parts of the body. They can be motor or sensory nerves. So depending on which nerve root is affected, different features will be produced. Multiple radiculopathies, radicular pain, sensory loss, motor weakness, urinary or fecal incontinence is very common in the involvement of the spinal nerve roots. Meningeal inflammation, myelopathy. So these are all the features associated with spinal meningitis. Now, some systemic manifestations, history of travel, sexual practice, and exposure to infectious agents is important. Infectious causes with fever, malaise, anorexia, signs of disseminated infection outside the nervous system. Because it's systemic, different systems are involved and affected. Major concern is in immunocompromised patient. Non-infectious inflammatory disorder produce systemic manifestations. Meningitis is initial manifestation. Carcinomatous meningitis may or may not be present. So systemic manifestations are also associated with meningitis. In these cases, usually we have infections outside the nervous system. There is a history of usually sexual contact or history of travel is present and very common in patients who are immunocompromised or immunosuppressed. So that was all about section 1, in which in detail we talked about first the chronic meningitis itself and then the intracranial chronic meningitis and spinal chronic meningitis. What's the pathophysiology and what are the systemic manifestations? So thank you for watching sqadia.com.